Welcome to podcast interview with Dr. Venugopal G, renowned neurosurgeon from Yashoda Hospital. Doctor, you are coming to Kolkata and giving advices to the patients, and they are going to your hospital to take surgery from you. So, what kind of patients and injuries you are normally getting from this Bengal and Kolkata?
Yeah, I'm a neurosurgeon basically. Okay. So I deal with all kinds of from the brain to the spine. Like I deal with the brain tumors, complex brain tumors, and sometimes there are some aneurysms are there which ruptured in the brain. Some stroke patients, and at the same time when we come into we have some other tumors called the pituitary tumors, and tumors which are compressing the eye nerves. And at the same time there are skull-based tumors we call them, or sometimes some patients will start losing the hearing. So we call it vestibular schwannomas. So these skull-based tumors, we are specializing in that. And coming on to the spine, in the spine we have cervical disc prolapses, cervical spondylosis, lumbar disc prolapses, lumbar spondylosis, and any kind of spondylolisthesis where the one bone starts moving on to the other bone, where the patients have severe back pain and which is related to the legs. And some patients in the spinal tumors also they can have these kind of problems. And where some of the patients who need fixations for the spine, fixation for the neck, we put artificial discs in the neck, we put artificial discs in the spine. So these kind of all complicated cases we can do. At the same time, we do something called minimally invasive spine fixations, where the patient needs any kind of implants, we can do with small holes with that. Okay. Those kind of surgeries. And some kind of tethered cord syndromes, where some of the babies who have a small tumors in the back, those things can be addressed with the help of neuromonitorings. And some of the tumors which need intraoperative MRI. So those kind of tumors, we have done some patients from here who is a doctor, we operated, she had a tumor in the main important area. So for which, where we need a intraoperative, during the operation we do an MRI, then we make sure that the whole tumor is taken out, so that we can avoid the radiation or chemotherapy requirements which are needed for the patient if at all if they are there.
Doctor, another common thing which is seen for the spinal and neuro patients, that is slip disc. So I think you are getting many patients who are coming to your hospital and to you for the surgery regarding this. So what kind of habits, lifestyle or habits can prevent this kind of slip disc problems, or only medical cure is the solution?
Right. See, first of all, slip disc is not basically, it's not a disease. It happens because of a bad lifestyle. Because it's a physical problem, not a physiological problem. In the sense, when somebody is trying to lift some 20 kgs or 30 kgs, when the body is not in a shape, the disc, it gives up, and in the disc prolapses, it goes and sits on the nerve. So when it sits on the nerve, you will have severe terrible pain. So the problem is, once a disc comes out, the disc has lost its integrity and it has lost its function. We cannot get it back. So that is what people think, that once we go for surgery in the spine, we cannot become normal. Surgery is done specifically to preserve the nerve, not to get the function of the disc. The function of the disc is gone. We cannot get it. So the whole idea is, if you don't preserve the nerve, the person will start losing that power in the leg. He will start losing his urine control. He will start losing his motion control. So all these are lost. So we need to prevent that. So that is the reason we do surgery. So the rest of the function of the disc which is there, like the way it greases the joint, that function is gone. That is the reason he may have a little low back pain which is left. So in order to prevent all these things, the person first of all should do regular exercises, should keep the body weight in control. At the same time, whenever he is trying to sit or stand and lie down on the bed, he should follow a particular posture, and he should regularly do some back exercises and neck exercises. And nowadays, because of the mobile, where the person keeps on looking down and the person keeps on lying down on the bed with the help of this laptops coming, all these things, they have basically spoiled all the body shape and body habitus. Then somebody has to do, he should have a workstation. Somebody has to look on the mobile, he should only look for some time. So that time he should follow it up. So otherwise, most of the patients, why we are seeing so many patients, it is because of their bad lifestyle. Not because of the disc is suddenly coming. It is they have chosen to come to a doctor.
They have created the problem.
Yes, they are not choosing not to come to a doctor. They are choosing to come to a doctor because of their bad lifestyle.
Regarding the care of the spinal cord, another thing often comes to the discussion, that nowadays people are using recliner or soft sofas, or some mattresses which are very super soft. Doctor, is there anything related to the injury to spinal cord or and the slip disc problem with all these things?
Yeah, we don't recommend super soft. They are only good to sit for maybe a couple of minutes, but not more than that. We need a if you sit in a super soft or slouching sofas, the spine is unevenly bent. So we need a good memory foam where it should not use the person when he sits, he should not go down back, and he should have a proper back support, and the spine should be straight. If you follow most of the time these things, the chance of he having a spinal problem will be less.
Okay. And doctor, another thing, nowadays we can see that brain strokes are very common. So in this kind of brain strokes, so surgery often is a solution. So what kind of recovery rate you see and what kind of complications during the surgeries you have faced, particularly when patients from West Bengal are visiting your
No, first of all, what we need
hospital?
to see here is the stroke. It doesn't happen overnight. It is a kind of outcome of the multiple things which the patient has accumulated before, like uncontrolled hypertension, uncontrolled diabetes, cholesterols, thyroid problems, and cardiac problems. All these things will form and will come out as a volcanic eruption in the form of a stroke. So when the person has already a stroke, means he will come with all this extra baggage along with him. So if somebody has a good control of these things, he will not go into stroke. So the problem is stroke, when it happens, it is damaging some of the nerves. That is why the patient is going into one side of the body paralysis. The whole idea of there is, if you don't operate the patient, the other side of the nerves also will get damaged. But because of the stroke itself, there is something called as primary damage which has happened. We cannot have any control on the primary damage. We are preventing the secondary damage. The damage which has happened. But some of the nerves which have not dead or damaged, we are going to preserve them. That way, once we operate, the recovery may range from, some patients may recover 90%, some patients may recover only 30 to 40%, depending on the amount of nerves which initially they got damaged. So all patients will not recover everything. And second thing, if the patient who has very uncontrolled hypertension, the patient may bleed again. In maybe 2 days or 3 days, the area can bleed because we are going to remove the clot. But the reason why it happened was some of the blood vessels are already damaged because of the chronic hypertension and diabetes. We cannot repair all of them. So the problem is that the more they are damaged, the more the chance of rebleed he can have. The more chance of recovery will be less. So that is the main problem. That too, here in Bengal, people use a lot of salt. So they should limit each person needs only 5 grams of salt per day. That means 1 kilogram of salt should be enough for 200 days for a single person. Now you can see how much salt you are eating.
That is the main precaution they can take.
Yes, we are stuffing our body with unnecessary required oil, refined salt, refined sugar, refined flour. All they should be banned. But nobody is doing that. All the biscuits we eat is full of refined flour. Refined oil. We know that they are going to generate free radicals. They are going to damage the blood vessels. Once the blood vessels are damaged, you get stroke. Basically, we are expecting it to happen. They are never a surprise. The kind of food we are eating, the kind of lifestyle we lead, they are not at all a surprise to have.
Okay, doctor, another thing, I was sitting outside, so I heard that you are speaking fluent Bengali with the patients here. So I want to know that what is the mystery behind this fluent Bengali?
না আমি তো যখন বেঙ্গলি কথা বলছি এটাতে এখানে 4 বছর ছিলাম আমি যখন এখানে ইনস্টিটিউট অফ নিউরোসায়েন্স কলকাতা আমি আগে এখানে কাজ করেছি তো ওটা জন্য আমি পেশেন্টদের সঙ্গে থাকি আমি কথা করেছি কথা শুনেছি.
And that's a huge advantage when psychological support for the patient. The doctor is speaking in Bengali. Yes, Hyderabad doctor, when I'm going to take the surgery, the doctor can speak in Bengali.
ওটা তো নিশ্চয়ই মানে পেশেন্টের জন্য কথা বলার জন্য সুবিধা হয়ে যাবে. পেশেন্ট হিমসেলফ ক্যান কমপ্লিটলি এক্সপ্রেস দেমসেলফ. ওটা ইজি হয়ে পেশেন্টের জন্য এটা they'll have a very the feeling of one will be there.